we've reported that about small businesses pay 10% of their payroll costs for health care. As a result, fewer small businesses can afford to offer coverage. From 2000 to 2007, the percentage of small businesses offering coverage dropped from 68% to 59%, while large firms held stable at 99%. Many individuals switched plans, 12% dropped coverage entirely. At our firm, what we did is we cut down, I gave my employee a choice actually, and what we did was to cut down the deductible, and we also cut down the amount of coverage from 100% to 80%. And we set up an internal savings program where I paid that money to my employee, so the difference in the coverage costs, so they would have that available to them. It's kind of like a little self-insurance program within our company. We believe that all Missourians should have quality, affordable health care, and health care no matter where they live or how much money they make. We want choices between quality public options and private options. 3 times a year I go to DC to talk about legislative issues, and we've heard from Charlie Cook, who met with the auto industry, and when the auto industry met with former President Bush, President Bush said, "I'd like to help you, what can I do to help you?" And the auto industry said back to President Bush, "Do something about health care. Health care is strangling the economy of our country." So it's not just small businesses, it's a big concern for small businesses, but it's also our entire economy is being strangled by the cost of health care and not getting the results that we should get for the money we spend, in my personal view and my personal experience. So I want to thank you, Congressman Carnahan, for this leadership. Thank you for having this event, and thank you for hopefully moving this agenda forward in the United States, and it will support all small businesses and our economy and all of our citizens. Thank you very much.
Thank you, Eric. I want to take a few minutes now to go over, at least do a quick overview of some of the things that are in the current bill, and also let you know about where we are in the process. As I mentioned last Monday, President Obama called this meeting in the House. 3 different committees have heard hearings on different aspects of the bill, and we've been advised that a week from today that there will be a bill it'll be called a manager's amendment or substitute because there are ongoing negotiations throughout this week, but the bill that will be debated on the floor we expect to be filed next Monday, the 27th, and we expect the House to begin debate on the 29th of July. So there are at least 3 days for debate, and we've been advised that if we need more, we will stay as long as it takes to get it done. So that's where we are in the process. Some of the basic principles involved in this bill as drafted is that basically coverage and choice. That people, they like their current insurance, they keep it. Preserves individuals' choice of doctors, hospitals, and health plans. It creates a health insurance exchange that is where individuals and small employers can shop among private and public insurers. It sets up affordability credits for low and moderate income individuals and includes a public health option. And as I mentioned earlier, discriminatory practices of the past with regard to pre-existing conditions and restrictions on changing jobs would be eliminated. So Very, very important reforms in terms of coverage and choice. As I mentioned, affordability. The affordability credits are available to individuals up to 400% of the federal poverty level. There is a cap on out-of-pocket expenses. It expands the Medicaid coverage to individuals and families at or below 133% of the poverty rate. As we've heard very eloquently, it also fills the Medicare Part D donut hole. It's phased in to do that. And also important for our physicians, it eliminates what would otherwise be a 21% cut in physician fees. That has been a really poor incentive for doctors to take Medicaid cases. Also, there's shared responsibility between individuals and their employers. It builds on the existing employer-based sponsored coverage, and also there are important cost controls, eliminating overpayments to Medicare Advantage plans, more efficient delivery. And there's a big shift in terms of emphasis on preventative care and wellness. So we're not just treating sickness, but we're working on wellness. And we all know that when someone has access to health care, they're going to be healthier longer, they're going to be less absenteeism at work, less strain on their families, but ultimately it's going to be less cost on our healthcare system. So important shifts in emphasis. Also, as I mentioned earlier, workforce investments for primary care. Doctors and nurses, scholarships, loan repayment programs, and also incentives for those professionals to go in underserved areas, whether it's urban or rural, so we're sure to get the healthcare professionals where they're urgently needed. Now, this proposal, we all know that healthcare doesn't come free, and I don't think anybody expects it to. The overall cost of the package has been estimated at about $1 trillion over 10 years. About half of that comes from savings and efficiencies in the system. Part of that has come from negotiations that President Obama has had with the pharmaceutical industry and other healthcare providers. So some of this is public, some of this is private, and the other half of that is funded by a healthcare surcharge on the most affluent 1.2% of Americans. The Congressional Budget Office most recently came out and analyzed the current plan and said that it was not only deficit neutral, which has been one of the important factors for the president and congressional leaders, but also that over 10 years it would create a $6 billion surplus. So it's important. It's important that we all listen to one another. It's important that we listen to one another. And so this is a short overview of the program. I want to introduce some other guests and healthcare professionals that we have with us here today. Let's start to my left, in the middle here actually. Amy Bluen is Executive Director of the Missouri Budget Project. It's a statewide nonprofit organization whose mission is to advance public policies that improve economic opportunities, and they've been especially active in the healthcare reform area.